have information that SHA will collapse in another 6 months.
Rigathi Gachagua has released another heart-wrenching or rather shocking dossier about the Social Health Authority. Gachagua says that in the next 6 months, SHA is going to collapse. Now, what happens to the hospitals whose pending bills haven't been paid? What happens to the health sector in the nation? Listen to this.
I have information that SHA will collapse in another 6 months and will have a crisis of unknown magnitude in the health sector. Today, as we speak, our hospitals, especially the faith-based hospitals, are owed 90 billion and they are almost shutting down. I want to give very humble advice, unsolicited though, to our hospitals. If SHA collapses, all our hospitals will collapse and we'll have a big crisis. Our hospitals should demand immediately the release of the 90 billion they are owed before they render more services to patients who come. Because if they don't, and SHA collapses, and they are owed billions of shillings, those institutions will collapse. I propose and I advise our hospitals to consider demanding upfront payment from SHA. We do the monthly average of what they collect from SHA. They get paid in advance so that when SHA collapses, they have their money. Otherwise, SHA will collapse with all our hospitals and the country will face a very big crisis that has not been seen for a long time.
Well, as you know, most of the information that Rigathi Gachagua comes up with, it's always looked down upon, but later on, it turns out to be the reality. You remember about the RSF leader, Mohamedi, that he talked about back then. Remember the issues about the arms dealing that he talked about then. Later on, they became to be a reality, and even recently, we saw that the person was given a diplomatic passports that are given to people with the highest regard of human life, highest regard of humanity. But if Ruto's regime could do that to a person considered as a threat to the world, then what is it that he couldn't do in terms of SHA collapsing? Well, now let me bring this to your attention. Have you ever asked yourselves, before SHA, we had the National Health Authority, we had the National Health Insurance Fund, just as we have the Social Health Authority, the same as we have the Social Health Insurance Fund. Now, this was not being made a compulsory registration for you to access services like they did some time back. We had chiefs in areas that were hunger-stricken telling the residents that they could not access SHA services or they could not access relief food unless they did register in SHA. As we speak, we have 20 million persons registered in SHA, or over 20 million, but only 5 million of them are the persons who are paying for it. What happened before SHA? Now there was NIF. What happened to the monies that were being paid in National Health Insurance Fund? By the time it was being shifted from NIF to SHIF, how much was in the accounts? And if we say the amount was used to develop this new system, you couldn't say or just ignore the whole amount was used to transfer this system into SHA. What happened to the contributions that persons made in the scheme? What happened to the pending bills that was being owed to the hospitals? It is the same question we should be asking ourselves. So much money have always been stolen from the social health insurance fund. In what manner? We have had hospitals being registered, yet they are non-existent, but they get monies to pay their bills. We've had hospitals, high end of them, being promoted into level 5 hospitals in registration and getting higher funding or getting higher, how could I say, they get more money than the bigger hospitals we've always known. Now, all this money should be going to someone's pocket. Just the other day, we were told 6.3 billion was withdrawn to a private account. To whose private account, we are not being told, but rather we know 6.3 billion went missing. Why should the government that is rather pretending to be so development oriented have a very porous consolidated account? Why would a government that is so obsessed with seeking a second term in office mistreat its own citizens? Make sure that the citizens, the same persons they want to vote them in, are being oppressed by the regime of the day. The atrocities against humanity amounts to these of stealing monies meant to help hospitals clear bills, to help hospitals take care of patients. We have dialysis patients, we have cancer patients, And if you really want to know that SHA is actually not working, we've had members of parliament, some of them losing their lives while going to seek treatment in India, clearly showing that that kind of treatment cannot be provided here in Kenya. Well, that is Joseph from Rigathi, Gachagua. As usual, after the church service, he went to Kirinyaga and he only wanted to confirm, does these people support the re-election or a seek of a second term in office of President William Samoei Ruto? And this was the response from the residents.
Hapa ni one time. Ate morauga atia. Ate morauga atia. Ate. Ate atia. Niguo morauga. Reke yone harambe. Wewe Ruto wewe. Wewe Kasongo. Wewe Kaongo. Wewe Zakayo. Wewe mwizi. Wewe muuaji. Wewe mtu ya Singapore. Wewe mtu ya kutenga. Wewe adui ya Wakikuyu. Kasongo aende asiende. Kasongo aende asiende. Wangapi wanasema Kasongo aende, Kasongo aende, Kasongo.
Well, what's your take? What's your thought in this? Kindly give me that in the comment section below. If you're watching from a YouTube channel, Kindly subscribe and press the notification button so anytime that we are live or we upload content of this nature, you'll be the very first person to be notified. Ahmed Khalif is my name for the Unscripted Talks here in Dab Radio. Assalamu alaikum warahmatullahi wabarakatuhu.
Kwa timba kali za Afrika, Dab Radio ndio mpango mzima.